Gareth with me. He's our top physio from the International Academy. He's coming from UK. He specializes in sports treatments. And we'll explain you how we can be really faster with that kind of device.
안녕하세요. Thank you, Fred. Really good to be here. So, the first thing about WINBACK is that it makes our treatments faster. In my training, when I'm training other physios, and certainly in my own practice, speed is really important. We have a lot of things that we need to get through in a treatment session, and the ability to now increase that speed for me is of paramount importance. The second thing that's going to make things faster for me is to be able to have 2 CT electrodes with no setup at all. So I literally just get straight into my treatment by taking the 2 CT electrodes and starting to work on the areas that I need to. The ability to actually target more than one part of the body when I'm working at a time, so I can use 2 and even 3 at once, is an amazing innovation. It does allow me to cover more ground in my sessions and maybe to focus on what really matters to the patient, that all-important communication. So to start with, thank you. So we'll start off with one body zone. This is something that we're all familiar with, and I'd like to say thank you to Hen-Yong for just joining us today. And the idea is we'll start off with a tripolar electrode, and let's say we're just going to work on the shoulder itself, and this is what we're all familiar with, just the ability to work on the shoulder. Again, with this multipolar electrode, I don't need to use a return plate, and this is what we've been used to from now. But let's just say it's not one side that I want to treat. I want to treat both sides at the same time. A quick change, and off we go. Thank you very much, Fred. Right. So now I'm able to treat both sides at the same time, using CET, and again, without a return plate. This is incredible innovation.
Yeah, with this possibility to work with 2 CT without return plate, that means you don't need to think about where do I put this return plate. You just install your patient and you work directly. So that's why you are really faster. It's really easier and you cover 2 areas. So that's why faster and more efficient with these 2 CT, which is really patented. Only BACK4 can do that, to work with 2 CT without return plate.
But let's just say it wasn't just the 2 sides that I wanted to work with, but down the length of the whole arm as well as the shoulder. Well, we're able to do that. Again, just a quick change of the electrodes to use the RET. Thank you, Fred. Okay, can you just hold this one? Thank you. Okay, and off we go. We're now able to work on the front of the shoulder, the back of the shoulder, but each one of these electrodes also is sending a signal all the way down to the hand. So I can work anywhere through the elbow. We can do that combine it with movement as well if we need, but successfully now working with 3 zones, the shoulder and all the way down the arm. Thank you very much, WINBACK.
So we didn't present you this. This is a new return plate. So now we are able to use the return plate to put the return plate on the hand. So that means you can do all the movement that you want to treat the upper limb. And as you can see, this little ring is just here to put some elastic band to offer more resistance when you do your exercise. Because you know, the resistance is the key for WINBACK. Each time you increase the resistance, you increase the effects because you attract the current on the resistance. So that's why we made this a specific hand probe return plate to have more mobility. It's always also the key for the WINBACK to always be in movement when you treat the patient.
Okay, so, but we also know that we can be more efficient. It's not just about the speed. We want to be quicker, but we also want our treatments to mean more. We want to have better outcomes for our treatment. And how does WINBACK do this? So with the ability to, first of all, to triangulate our position. So we can use more than one, both of the electrodes and the return plate to create a focal point which we can concentrate the treatment. So therefore, we're able to be more effective and we're able to penetrate deeper and to achieve the results in more specific locations that we want. But we can also set up the electrodes in a row. So if we're treating the whole leg, for example, we're then able to accumulate the effect all the way down the limb. Before, all we had was an RET electrode and a return plate. Now with a second one in there, we can accumulate the intensity of the treatment and make less time but more efficient because we can target a bigger chain much more effectively. The third thing that makes it more efficient is the power. We want to know that if we select 40% intensity on the machine, that is exactly what is going to be delivered. And thanks to the intelligent power management system, we're able to do just that. It means less going back and forth, and as Fred already explained earlier, it doesn't matter how far the electrodes are from each other, the system will automatically calculate the most efficient power. And the last thing, which is really incredible, is the ability to have different frequencies. So if we look at TECAR plus high tens to focus on the pain management aspect of it, we can also say, well, we want to reduce muscle spasm, so we've now introduced a medium frequency current, the EMS, which we're able to use to reduce muscle spasm. And that's not all. If we want, we can mix all three, so we can target the muscle and pain relief all at the same time. So let's see what that looks like.
So if you want to work with in a triangle with a 3-body zone, in that case you pick your 2 resistive electrode, then you have your return plate. So let's say I put my 2 electrodes over there, and then as you can see, you can draw a triangle, please.
We can draw the triangle. Did you see the triangle?
So this is a triangle. Yeah. Now, just to be clear, we can triangle the signal. So because my energy will come from my 2 electrodes and finish on one point on the return plate. Let's say you have a muscle injury, then you want to focus the energy to finish the energy on the injury. Use your 2 electrodes like this, and then you will use the triangle possibility, the triangle modality to target directly the injury. So now we can change, because it's another way to use the 3-body zone. We can use it in chain. So in chain, that means we will accumulate the effects. So let's say you have like a sciatica. In that case, you put the fixed pad on the calf, and then you use your 2 RET like this. So I have first 1 electrode finishing on the ground plate, and then the second one will be reinforce the signal because I have a second signal. So this is the addition of these signals which make the difference.
Okay, but it's not, what if we want to work on pain relief? There's a sciatica all the way down. What can we do then, Fred?
So in that case, I can use the same modality in chain, but in that case, I will select the high tense. So with the high tense, as you can see, the color is a little bit different because on this TECAR X, we have the possibility, the TECAR X will recognize each accessory, CET, RET, but will recognize also the mode that you have selected. So in this case, as you can see, we have the dark blue or we have a light blue. Light blue is the color for the high tense. So if I use the RET plus the high tense, in that case, I have the 2 effects, the effects coming from the TECAR, the effects coming from the high tense, and then you select 2 Hz, 5 Hz, or 25 Hz if you want to work in acute pain, in that case, you will use the 2 hertz on you will use the 25 hertz. And then if you want to work in chronic pain to have the endorphinic effect, you select the 2 hertz or 5 hertz. But if you don't know, in that case, select the dynamic, because the dynamic will scan automatically 2 hertz, 5 hertz, 25 hertz. You will cover all the kind of pain, from the acute to the chronic.
Okay, but let's just say, for example, there's a lot of muscle spasm, but it's not only in the surface, but it's also deep within the muscle. What could we do then?
So in that case, I won't use the high tense, but I will use the high EMS, because the high EMS will recruit the deep muscles. As you know, when you have the TK current which flows through all the tissues, it will finish on the most resistive tissue. So in that case, if I have a contraction during this flow, in that case, the contraction will keep the energy, and then because it's a deep contraction, I will have an action on the deep muscles. You know, this is the key when you have a chronic injury. Chronic injury, all the time you have the deep muscle which are involved. You know that because you are a sport therapist.
Yes.
So, and it's always really hard to target these deep muscles because you have to press very hard from the outside.
And it's painful.
And it's painful. So right now, with this, you have this contraction coming from the BACK4, which is delivered with the electrodes, plus the TK that you all know, because the TK is the diatomic effect, the biological effect, and also pain management. So if you use it like this, in that case, I will select the radial high EMS to target the muscle chain. Or if I want to have a deep action, in that case, I will change this fixed pad. I will put the return plate on the quads. And then I will have a deep action to select, to target these deep muscles, which are the keys.
Okay, Fred, I'm going to be really difficult now. I want to target both the muscle spasm and the pain at the same time. Can you do that?
Yes, for sure.
There we go.
We can do that because we have the possibility to deliver 3 different currents. We are able to use TK, high tense, high EMS at the same time with these 2 electrodes. So in that case, you put and then you can see it's flashing, and then you have the 3 different colors, and you have the 3 different currents, TK, high tense, high EMS, and you can have everything in one.
That is absolutely amazing. So Fred, tell me more about the precision.
So we can be really more precise, because as we explained you, we have this high EMS signal, which is just crazy. You will see the revolution comes from this high EMS, for sure. All the effects are here, because we have all these problems, how to target these deep muscles, how to treat these deep muscles. It's so difficult to reach it manually, and there's not so many, I don't have any other equipments who could reach these deep muscles. So right there with this high EMS plus the TK current, we are able to target these deep muscles. Then we also have this specific electrode, the high rate electrode. So this electrode comes from the high tense. So as you can see on the screen, this specific electrode, you have 100 points concentrated in 1 square centimeter. So you focus the energy and you display the energy on 100 electrodes. So that's totally new if we compare to the other electrodes that we know, which are really large. This specific electrode, you have 100 stimuli at the same time, so you can target the tissues. So that's why we have very good results with this specific electrode to target the fibrotic tissues.
Okay.
Oh, God. I did.
Here you go. This one.
But also, we can be very precise because we have these 2 independent bracelets. So please, like this. Put the bracelet. So you can imagine some, let's say, it's maybe crazy for you, but we can have that kind of montage. We can have that kind of modality. You can use the bracelet on the patient, the hand return plate on her hand, and then I put the bracelet. So now the intensity, the power is engaged from the bracelet to the hand probe, and then I have my second hand. I can target the tissue. So with this, I have one signal, which is closed right there, and then I have my second signal coming from my hand, and I can target with my fingers. In that case, you can imagine I can do some mobilization, but because I have this second independent bracelet, I'm able to target specifically one area to target the joint, and then it's still the same. I will focus and I will amplify the signal because I have this second signal which is arriving on the joint. So now the question is, are you TECOR or TECAR? TECOR, transfer energy, capacitive or resistive, or TECAR, transfer energy, capacitive and resistive. Because I explained to you, now we are able to answer to this definition. We are able to fit to this definition, the real TECAR, transfer energy, capacitive and resistive. So it's not because we have the TECAR that we throw away everything. We still can use the TECOR. That means we can use the capacitive on the return plate. So let's say I want to treat my patient like you do every day. One capacitive, one return plate, and then I can relax the muscle. Okay, I want to switch for the resistive. Okay, that's easy because I can change for the resistive. I don't need to think about, oh, I need to change my hand probe. No, this is the same hand probe. The TECARX, capacitive, resistive mix, everything goes on the hand probe, and you see it's really easy. Each time you want to change, you can change. So let's say I want to use two capacitive at the same time. Okay, no problem in that case. You need to connect.
Oh, yes, that's also true.
Okay, so now I can do two body zone with my two capacitive. I can treat without the return plate. I can treat the shoulder. Imagine you have a low back pain. That's really easy because you can use your two capacitive at the same time. So you cover a large area to relax the muscle. So when you are treating with TECOR, it's for the easy pathology. Okay, easy pathologies. That's better with the S. So when you do the CET, you relax. You do two CET, you relax the muscle. But you can also use only two RET. Because right here, you see, I have my two RET connected, but it's in blue. All are blue, so that means it will finish on the ground plate. I want to switch. Okay, no problem. I tap my two electrodes, and now I have one RET in blue, one RET in white. So that means now the energy will pass only between these two electrodes. So if you still want to work on two body zone, in that case, now the energy will pass. Let's say I want to focus the energy on the joint, on the knee joint. Okay, that's easy, but okay, that's not enough. I want to change. Okay, now I tap my two electrodes, and then I have my two electrodes in blue, so now I will be in three body zone. So that's really easy to change from two body zone, three body zones, but the question was, are you take-R or take-R? So let's see what is the take-R. Can you remove this one? So take-R. Take-R, we said, capacitive and resistive. So let's take the same example, the sciatica. Sciatica is a complex pathology. It's like the frozen shoulder. That's hard to treat. So usually what we do with the BACK1 or BACK3, we use the CET to prepare. Then we use the RET to go deep. And then we go back to the CET. So we're always switching from one electrode to the other one. Right there we can do RET on CET at the same time. But let's say I use the CET right there, the RET. The RET is connected, so that means I will cover all the sciatica nerve, the irradiation. But with my CET, if I put my CET between the two electrodes, then I can follow the nerve, I can release the tensions. But as you can see on your screen, the CET is wider. It's wider because I have an accumulation. I can boost the signal of the CET coming from the fact that I have my RET on my return plate. I have two signals, so that's why I can boost the energy on the CET. So that's why it makes a big difference between the take-R or the take-R. Take-R are really more efficient when you are in complex pathology. Each time you have some difficulties to treat your patient because it's a long process, then because you combine RET and CET at the same time, and for sure because you boost the effect of your CET, you will be really, really more efficient.
Okay, and finally, it is easier. And the first thing that makes it easier to use is the fact that there's an automatic adaptation of the power. Before, what you'd have to do is if you move the electrodes or if you have patients with different tissue types, you'd have to adjust the power automatically manually in order to be able to achieve this. WINBACK now allows you, and BACK4 in particular, allows you to automatically adjust this. This is a great innovation which adds more valuable resource to the way you work and allows you actually to speed up your treatment sessions.
It makes it easier because we have 11 electrodes for each probes, on both probes. You see, we have all these electrodes on the, as you already saw, it's really easy to change. So we have 4 CET electrodes, 4 RET electrodes, plus 2 multipolar, plus the high rate electrode. So, but it's easy. You just have to connect and disconnect your electrodes.
Okay. And as Fred has been saying, BACK4 will automatically recognize which accessories you're using. In particular, for example, this fixed return plate, once we apply that, normally what you would do is you'd bring down the power and you'd switch to, on the BACK3, what would be a low pulse. But with the intelligent recognition that is within BACK4, it will automatically recognize which accessory that you're using, reduce the power to 40%, and change the currency from a continuous one to a low pulsed one in order that you are safely applying the electrode.
BACK4 is easier because with your TKRX, you are able to control the BACK4. You have a remote control in your hand. You can increase or decrease the intensity. You just need to tap on the TKRX, and then you tap 3 times. You increase the intensity. You can hear that we pass from 10% to 20%. If you tap 2 times, in that case, you go back to 10%. But that's not enough. That's not all, because I can switch from RET to high tense. I activate the high tense. I want to have the high EMS. I just have to do this movement, and then I activate the high EMS. So it's really easy to control, but also, as I showed you, if you want just to disconnect the return plate, then you just tap your 2 electrodes, and your return plate is disconnected. You don't need to unplug. That's why it makes it easier, because you just tap your 2 electrodes and you return back to the 3-mod zone.
Well, if you're anything like me, after listening to all that, you're like, how am I going to remember all of that? Well, the brilliant thing is that all the protocols, all the safety procedures are all included in BACK4. So just at the touch of the touch screen, all the information is literally at your fingertips.
So